Data tabled in Parliament by the Union Health Ministry has highlighted wide disparities in India's nursing workforce, with South India leading the country's registered hospital nursing workforce compared to several popular states in the north and northeast. In a written reply to the Rajya Sabha, Union Health Minister J.P. Nadda stated that India has around 4.6 million registered nursing personnel as of December 31, 2025. They include 3.4 million registered nurses and registered midwives, more than 1,059,000 auxiliary nurse midwives, while about 55,000 are lady health visitors. The data shows that South India is the country's nursing powerhouse. Kerala tops the list with 3,79,000 registered nurses and registered midwives, recording 10.47 nurses per 1,000 population, the highest in the country. While Karnataka has the largest absolute nursing workforce with over 5,30,000 registered nurses, translating to 7.69 nurses per 1,000 population. Andhra Pradesh records 5.72 nurses per 1,000, while Tamil Nadu reports 5.09 nurses per 1,000 population. Together, these four states account for nearly 46% of India's registered hospital nursing workforce, despite representing only about one-fifth of the country's projected population. Among the southern states, Telangana, however, remains an exception. It reported just 1.58 registered nurses per 1,000 population, despite Hyderabad's emergence as a major healthcare hub. The contrast becomes even sharper in several north and eastern states. Arunachal Pradesh ranks third nationally with 6.81 nurses per 1,000 population, while Punjab, Delhi, Sikkim and Mizoram registered ratios above the national average. Among the states with least nursing workforce, Bihar recorded the lowest nurse availability with only 0.15 registered nurses per 1,000 population. Jharkhand followed at 0.26, while Jammu and Kashmir recorded 0.35, although official data there are available only up to the end of 2021. India's most populous state, Uttar Pradesh, has the country's third largest nursing workforce in absolute numbers, but its massive population reduced the ratio to just 0.96 nurses for 1,000 population, well below the national average. Other large states also trailed the national average. Assam recorded 0.97 nurses per 1,000 population, while Odisha recorded 1.11, Maharashtra 1.47 and Haryana 1.50 per 1,000 population. The parliamentary reply also highlighted trends in overseas nurse migration. Kerala remains India's largest source of internationally migrating nurses, although immigration has steadily declined over the past 3 years. Tamil Nadu, Andhra Pradesh and Telangana witnessed a fall in overseas migration, while Karnataka has remained largely stable. In contrast, Jammu and Kashmir has recorded a steady increase in nurse immigration during the same period. Responding to concerns over nurses' salaries and working conditions, the centre said pay and working conditions of nurses fall under state jurisdiction. The Health Ministry added that expert committee will recommend on improving nurses' conditions, and it will be shared with all states and union territories for implementation. The findings have underlined both India's continued shortage of professional nurses and the widening regional imbalance in the country's healthcare workforce.